Purple Toyota. The morning is waking slow and the traffic's not moving. Hey everyone, we are back, thank God.
Yeah, guys, we're back. Just an update on some stuff that's going on with us.
We got caught. We have been on our own lockdown, way past the time of lockdown. We haven't gone anywhere. We haven't done anything. And just recently, when the numbers were looking good, we decided to start going out a little bit more. And ever so careful with the masks, with the alcohol, with the sanitizer, and trying to keep our distance and be careful with what we were doing. And we couldn't escape it. We were positive for COVID. So I know the country's going buck wild right now with a lot of new cases popping up. We think we got it from one of our kids that is about to become a nurse. So even though we did everything we possibly could to stay away from it, it found us in our home. You know, it's all good. We're here to actually share with you what we did and how we found out that we had it and what we did to combat it. All of the kids got it. The whole entire house. I think my daughter was really sleepy. A couple of days later, I started to feel not so hot. I was working really late and I was like, I can't finish this. I just have to go lay down. And by the time I woke up the next morning, I called him at work to tell him that I didn't feel very good at all. And I wasn't sure what was going on with me. All I know is my head was about to explode. It was terrible. I try to practice caution. I kind of looked it up because I'm still breastfeeding Sarah. So I looked it up to see if it would be safe to breastfeed her or if it would be of any benefit to her or if I should just totally isolate from her altogether because I've been breastfeeding her just hours previous to kind of realizing what might have been going on with me. So mind you, nobody else was really sick in the house. So we didn't really know what was going on. And so I was the first person that actually got really sick. And so by the end of Friday, I was extremely sick with this thing. The kids actually had to take care of Sarah for me. They just brought her to me when I had to change a diaper. And it was terrible. I was masking. I was taking every precaution I could probably take. The only thing I had to do was I had to change Sarah's diapers. And they came home, and thank God he was okay at that moment in time. And so he kind of helped to take care of me a little bit, but I was out.
So it's one of those things where it hits you. It's something that comes on real fast. It's not really, well, for me actually, it comes on real fast. It wasn't something that, that progressively got worse or whatever. It just hits you. At 1 minute you could feel good, then the next day you're down for 2 days, then you feel better, then the next you're down for 2 or 3 days. Especially headaches. Headaches is a big deal. My eyes were really achy. I just didn't feel like myself. It wasn't, thank God, it wasn't anything where I didn't feel like I was dying, but I think my symptoms was like I just didn't feel like myself. I guess that would fall under not fatigue, but just like foggy. I couldn't really focus. I couldn't focus.
Okay.
So I was, I couldn't focus, and I was really like tired and like really tired. I slept a lot.
Yeah.
I was really
tired.
tired.
We both were sleeping well. And the kids basically did everything. We don't have family close by, so it wasn't like we could send them somewhere or have somebody help us. I know Nick's mom was really concerned. My parents are in Canada. I do have family in New York. We both have family in New York. Yeah. His mom was really concerned. She's like, do you want us to come? Do you want me to come? And I was like, no, we're sick. Yeah, we don't want you to come, even though she's vaccinated and everything, but we know there's breakthrough cases. So we didn't want to contaminate her at all. And of course, you want to be careful, especially with anybody that's older, right? So I went down first. The kids manned the house. Thank God, the kids were really good with the younger kids. So that was a good thing. And Nick was very good in expediting, setting up a COVID test for us to go ahead and test. So a couple of days later, we both tested and we tested positive. And then once we tested positive, we knew that we had to test the others because one child got sick.
Just by me just analyzing the whole situation, I think it's like every 2 days. Like it actually went through everybody in here in the house, and it was like
About 2 days.
it takes 2 days, and then you could see, you hear a cough,
Symptoms,
or
yeah.
you see symptoms, any type of somebody head's hurting, stomach don't feel right. So everybody had different symptoms. So this thing, it just attacks everybody differently. So my symptoms may not be as bad as your symptoms, and your symptoms may not be as bad as mine. So it just all depends on your body and your makeup or whatever, however it works. But what I can say is that you'll feel good one moment, and then the next moment
you feel terrible.
You feel terrible. You feel like you're getting better. You know, like they say, you feel good and then you don't feel good. It's true. But just to witness it, just to go through it yourself, it's kind of like a little bit scary to know, like, because you don't know if you're ever gonna feel better. Because you feel better one moment, and the next moment you're not. Then you know what I mean. So you're always an edge. Like, am I ever gonna come out of this slump?
Yeah.
So I mean, but thank God, you know, I think we've turned the corner on it. So
yeah.
We're feeling much better than we were yesterday. So I mean, that's a good thing. But I just want to say this. I know a lot of people are reluctant to take the vaccine for whatever reason. That's your preference or whatever. But you know, if you don't do anything, at least if you feel sick or if you feeling any type of symptoms, headache, whatever it is, I would recommend just taking a test just to verify and just to make sure that if you have it, you're not spreading it to somebody else.
Nick and I thought it would be a really good idea to show you guys exactly what we used when we got sick. Okay, so here, right behind me, I have a nice little spread of everything that we use, and this is how we fought COVID. So I'm gonna go through a little bit about my symptoms that I had. I think I talked about it a little bit earlier, the headaches, the fever, the cough. The thing with COVID, it was so sporadic. Like, it was 1 minute this, 1 minute that. I had one day when I was vomiting for half the day, and like a few days, when I was just like totally nauseous, thought I was pregnant again. And at least that's what it felt like. So, you know, it's just been crazy. And then as of recently, I actually noticed that I had like a really bad rash, and when I looked into it, it looked like it was a COVID rash. And some people actually post-COVID had like a COVID rash. 4 weeks in, I read various articles and research studies showing people actually came in with a COVID rash. And it was like a very fine rash, and it was like all throughout my arm, my 2 arms, and it was just localized. It was slightly uncomfortable, but it wasn't like totally itchy or anything like that. It was just weird. And then it eventually just went away. No treatment, no nothing. Nick actually ended up having to go get himself checked because he had a prolonged cough. And so it's been like about 4 weeks since we actually were sick with COVID. And I think we still have like tiny, minute residual effects. I've been dealing with some issues with my tummy. So that is something that I personally have been dealing with, which I think is totally COVID related. But anyways, so I'm gonna show you, this is a spread of all the things that we have here. And Nick is about to join me in a minute. Okay, so the first thing I wanna share with you guys is this vitamin C, right? So this is something that I keep in the pantry. This vitamin C, I don't always use the immunity version, but ignore my funky manicure. I broke a nail today. But anyways, I don't always use the immunity version, but our whole entire house swears by this. When we have colds and so forth, we definitely go ahead and take these. I know I learned a long time ago when I was in a clinical setting from older nurses that if you want to get rid of a cold, you do vitamin C every hour. Okay, so you do vitamin C every hour for like hours or however long until you actually have a loose bowel movement, and then you stop, because vitamin C is actually water soluble, and once you have a loose bowel movement, that's your body's way of telling you you've had enough. Quit the vitamin C. And so that really works for colds. I've used it on the kids, I've used it on myself. So I swear by anything that has like large doses of vitamin C in it, so we use that. Oh, I don't have my big bottle of vitamin C, but we have a big chewable bottle of vitamin C. Now, can you see if you find that bottle? We have a big chewable bottle. I always keep that. I'm inside the house. We have the kids' vitamins. just regular run-of-the-mill Flintstones multivitamins. The gummy vitamins, honestly, are not that great for your kids. So, I would stay away from those because one, it has a lot of sugar, and two, it's not good because it'll rot their teeth out over time. So this is a toddler version. We got to Sarah. We use vitamin D2 and we use vitamin D3. And of course, these were for the adults only. Do you see? Maybe they finished it. Is the vitamin C chewable? They might have finished it. I think the vitamin C is finished. So I probably have to get another bottle on our Instacart shop. So the D3 and the D2, that I know has been a big one for COVID healing. So it offers immunity support and it also offers metabolism and it's good for energy. So you know how you're down and out, you don't have enough energy, that can kind of help with your energy levels a little bit. I'm gonna tell you the truth. You don't feel like doing anything when you have COVID, but based on my experience, just even professionally and personally, if you stay down, you can make yourself down for the count. So if you're sick, force yourself to get up, sit in an upright position, make sure you do some deep breathing in through your nose, out through your mouth. That is really, really important. And walk around and get moving. I got up. I swear I almost fell down at one point. I probably pushed myself, but I got up. I was moving around. I was trying to wipe down, clean up, using, of course, Lysol sprays. I had these continuous spray bottles are amazing. They sell them on Amazon. They're continuous spray bottles, and I don't know if you see, but it does a prolonged spray. I love these bottles. They're like aerosol without the aerosol. And in this one, there's actually bleach and water. So I put a tip of soap in there. I put half a cap full of bleach in there, and then I fill it up with water and disinfect with that. And then you get a fine mist everywhere. Also equates. I'm not advertising the brand, just the alcohol. Always 90% is what I like to use, but in these times, you get what you get. I actually fill the alcohol in these bottles, and this is actually what I carried when I was out. When we would go out with the kids, we carried these spray bottles. Okay, and so this actually has alcohol in it. I probably should label them, but I know because one is super clear and one is super cloudy, so I know what's in what. You keep them separate. Then your hand sanitizer. I got this hand sanitizer pump. See, guys, I got this at Home Goods, so you guys can go and get yours. These are very nice and chic to put around the house. Now, I'll always, hand washing is essential. I don't suggest that anybody simply use hand sanitizer and not soap and water, but it's good, especially when everybody's sick in the house and we're walking around and we're kind of just I know you have kids, so I would just use a hand sanitizer, get them to just use it often, frequently, even for no reason, just kind of get them to use it. Not too much so that their poor little hands are drying out, but just enough, right? Every now and then they put some hand sanitizer on. Initially, we had it at the bedrooms. And so, upon entry and upon exit of the bedrooms, we're definitely using the hand sanitizer sprays. And pretty much in and out of every room, I was just encouraging everybody to pump, right? And just to kind of keep the germs down. I know we already had COVID. I know it was not gonna fight anything more. It's just to keep the germs down because the house is already infested. Okay, so back to the vitamins. So this is amazing, okay? These kid immunity things, because the kids want to take them, one. And it has your zinc, your elderberry, well immune, and your vitamin C's in it, right? So there's everything that the kids need for immunity. So I like that they have that. And that's Ollie. Ollie has a lot of different kinds of vitamins for the kids. I actually just ordered another one, but Instacart got it all wrong and they gave me the probiotic one. I don't need that. But because I'm breastfeeding, did the prenatal multivitamins. And I have a general vitamin, I just didn't bring it out. For adults, I'm gonna tell on Nick now. So Nick does not really do multivitamins, but he does do tons of the vitamin C, and he did do the vitamin D's. Men can be funny with that. He did do the vitamin C and zinc, so he definitely did that. And zinc is a big one for immunity. So if you guys are suffering from COVID, I suggest, before it even comes your way, make sure you're taking zinc and you're stocking up on the vitamin C and zinc. Preferably separate. I wouldn't necessarily recommend them together, but that's all I could get, so that's what I took. Chlorophyll. Guys, I am not like promoting anything or telling you, yes, go ahead and get your chlorophyll because this is a magic cure and it works. Nothing that I'm showing you is a magic cure. This is just what we did. A whole entire family of 8 to get past this COVID thing, right? And so I used these chlorophyll drops. I actually went and read on it, and there was some type of research showing that it may have some effect on the virus. So you do your own research. There's really not a lot of research out there. So there's absolutely no proof that this works. But one thing I can tell you is when I started to, like when I was in my right mind enough to start taking this, I took this and it was like, I felt better like suddenly, like within hours, I just felt better. And I did it on another day and the same thing happened. So after that, I was definitely on it. We use the Vicks bath, a lot of sniffles, stuffy nose, sinus issues, so we use the Vicks bath. I actually we steamed with this. This you can get on Amazon. Most of these things you can get on Amazon. Some I got at Publix, but like the chlorophyll at Amazon, and the vitamins, Publix, and the D's you can get on Amazon as well. Wipes. These wipes, these little cheap dinky wipes, or at least this is what I thought. Anyways, these little wipes that, what was the store we got them from, Nick? Where did we get these wipes from? They were really affordable. Well worth it. We didn't know we were gonna need it. Aldi's. Aldi's has these box of wipes. They have scents, which I don't really care for, but it works and the kids will use it. So we got the hand sanitizing wipes, the sprayer, another sprayer. This was not really necessary. I think when I was in my state of delirium, actually, the first day I was sick, I went and I ordered a bunch of things off of Instacart for the kids because I was like, oh man, they have to take care of themselves. So I just went crazy with anything cleaning. So I ended up, this got into the cart too. So we were using that. So I got a bunch of frozen dinners on Instacart for them to be able to feed themselves on the first few days, just in case, because I was like, man, I don't think I'm getting up from this anytime soon. So they were able to take care of themselves via frozen dinners and water, tons of water. It can be hard to drink water when you're not feeling well. I personally like the alkaline waters. I know there's no like definitive research that says this like makes your body more alkaline or anything like that. It's not good to be too alkaline, but you know, they show that alkalinity, alkaline diets, it kind of fights cancers and does a bunch of other things. So hence it was alkaline water for me. We buy this by the case all the time when we do our big shopping at the end of the week. I try to get some of the alkaline water. And then Dasani, that's the one. I'm not advertising the brands once again. This is just the water that we happen to have at that particular time. I like Dasani though. Another item that I didn't share with you that I thought was super, super important to have is, let me show you. I just recently did over the pantry. I'm probably gonna like show you guys a little bit of it in another video, but this is Pedialyte Sparkling Rush. This stuff is amazing because one, it kind of tastes like soda. It comes in these little packets. It's like a brand new box. I'm not gonna open it, but it comes in these little pouches and you could use the pouches multiple times. And it's like a fizz, right? So you know the kids love anything soda-ish and it's really great for adults too. So we definitely had these. And for the kiddies, I don't know that they love these. Some of them did, some of them didn't. The Pedialyte, just so that they can get, you know, some electrolytes back into their systems if they weren't eating that well. The kids honestly really didn't get that sick. So that was an absolute blessing from God because I was so super worried, especially about Sarah, because she's so small and she's still breastfeeding. So I was so scared that she was gonna get super sick. These little pops, the Halls pops for the kids, that was really good too. Let's see what else. And Cepacol. So these Cepacol lozenges, whenever I'm sick, I swear by these because it helps with your sore throat. It kind of helps with your cough and it kind of gives you like a numb type feeling in your mouth. So it definitely cuts some of that pain. It quiets the cough. It's really fast acting, very fast acting. So Cepacol. And they actually use this in clinical settings as well. So I know this is a really, really good thing. Don't forget your acetaminophen. If you're an adult, acetaminophen, or your Tylenol, 500 milligrams, 325 milligrams, whatever. I really try to stay away from it as much as possible. I like to take a low dose of 325 for me personally. Tylenol kind of wipes me out, but Nick was taking 500 milligrams of the Tylenol, so it really worked for him. For me, I was definitely spiking temps, so every now and then I did just go ahead and do the Tylenol. And for the kitty, for Sarah, I gave her the Chewables. So this was just like a generic brand. It's an Equate brand. Who does Equate? I think it's Walmart. Run of the mill, acetaminophen for kids. I like these Chewables because once the kids get to a certain age, like 1, look, I'm a nurse, so I split these things up and calculate and do it. I don't advise you guys to do that. Follow the way the box says to do it, but I split them up and, do all sorts of crazy things with them and give it to them. You didn't hear that from me. This is really good because they'll take it, right? It's better than like a syrup or something that they're not gonna swallow. Join me. Okay, so one of the most important things, this was Nick's absolute favorite. His favorite thing was to take his his temperature. He was like constantly checking his temperature, as was I, because I actually had fevers. I don't know that Nick actually had fevers.
It's weird because I don't know if I had a fever. I slept a lot, and the house was hot, and I was under the covers and I was sweating a lot. I didn't check my temperature at that point. I might have sweated out, so that's the only thing I could think about that really happened. Why I didn't realize that I actually had a temp.
This thermometer is what you call a temporal thermometer. Now they have I don't know why I don't have one, but they have the no-touch scanning thermometers. They're about $100 or so, give or take.
I think it's called infrared or
yeah, they're infrared. Yeah, they're infrared and they're basically touchless, so it minimizes germs. So with these ones, you just like at the temple, you go back and forth, and it will read your temperature too. The only thing is, if you're not used to this thermometer, you might have to like practice doing it a few times to get it right. But these are really good. This here is what you call a oxygen saturation monitor.
So this oxygen sat right here, like she said. I'm gonna give you guys a close-up on it. This is just one kind.
You just pinch it.
It's you just open it up like that and stick your index finger in there.
You can actually stick other parts of your body in there. You can actually do the earlobe and other parts of your body. Sometimes women have nail polish on and it doesn't read well, but for kids, you can do different parts.
So this out of anything that we talked about, I think this is the most important because when it comes to your breathing, you want to make sure you're having enough oxygen. Your oxygen sat is very important. So so you should check your oxygen sat every day if you realize you're COVID positive, you should go ahead and check every day just to make sure you're not losing oxygen. Because from what I read or from what I heard is that you could be losing oxygen slowly and not realize. This is the most important things that you would need, I think, in my opinion. So
yeah, this is really good, and it's also good. Just grab a baseline. So like Nick likes to check his oxygen saturation every now and then just to check it. So he already knew what his baseline sat was. Generally, this one is going to be 95% and above for your saturation, and it's also going to read your heart rate, so you can tell if your heart rate's going up, if it's going down. I personally was what you call tachycardic all the time. I went to 130s. I didn't get it checked. If you guys go to 130s, get yourself checked. I kind of know myself really, really well. I have a background in healthcare. So get one of these. This is really good. Your blood pressure should be checked every now and then, whether you have high blood pressure issues or not. Neither of us have blood pressure issues. I have one in the house. I make sure that we check occasionally to see what the blood pressures are. If I feel like I have a headache or if anything is wrong.
Like mostly the blood pressure, like I would check my blood pressure if I'm hurting, if something is hurting for a sustained period of time. That's abnormal, then I'll check my blood pressure just to make sure everything's right. But it's not something that I would just check on a regular. I'll check it if something is off.
Nick is right. When you're hurting, your blood pressure can actually skyrocket. It can go up to a level that it's never been to before. With this, the first day that I had a headache, the first couple days, my blood pressure was in the 130s, which is abnormal for me. I usually run really, really low in like the 100s, 110-ish. Yeah, so 130s, 135 was really high for me. Your blood pressure, depending on your age, really shouldn't be going over 140. And if it is, that needs to be addressed, especially if it's consistently over 140. I'm not gonna go into blood pressure norms because it does vary across age groups. And what is normal for one person sometimes is not always normal for another person. And you also have to take those things into consideration as well. So the blood pressure is definitely a must.
And if you're ever in doubt about the blood pressure stuff or anything, just Google.
Look it up. Google
just
is
Google
your best friend.
Or go on WebMD. That's what most of these doctors use anyway. Just go on WebMD. You'll find it. Just
Yes.
believe it.
So you guys are going to check on a reputable medical website. We all know that WebMD is reputable. Mayo Clinic is reputable. If you're not sure, contact your doctor. And before you take any of these things that I have shown you here today, please consult your doctor. Another thing that we did was we drank a lot of hot tea. I know that it's out there on the internet and they said that there's no proof that it works. I don't care. We've been drinking tea from we were babies.
It's ginger, garlic, and lemon, right?
Yeah. We had a little bit of fever grass, but I think it was like dried up. We were gonna put that in there, but we didn't use that. And so we had those things that we boiled and we actually made teas out of. And then the other big thing, when you have COVID, please, I beg, wash your sheets. Wash your sheets. I was changing sheets like crazy. I couldn't do everything. But if it's just a matter of picking the sheets up and throwing them in the machine, if you can get out and do that, wash your sheets, because remember, COVID is something that sticks. It sticks to your hair, it sticks to your sheets. And you know, the more the virus is all over, I think it could be worse. Nobody knows, right? So just try to keep clean sheets, and hot soapy water is even better. So, and hand washing, like really teach your kids to hand wash. That is priceless. I don't want to be liable for any of you guys taking something and something going south, because I am not a medical doctor. I'm giving you information, both myself and Nick are giving you information based on our personal life experience with our family of 8 who did fight COVID. 6 kids in the house. It was wild. Thank God our kids were not that sick. Jonah was like a superhero. He had like nothing wrong with him, even though he tested positive. But yeah, so that's it.
All right, guys. So until next time.
Oh, hold
we're
on,
out.
Nick. You keep forgetting to tell them to subscribe to our channel.
Oh yeah. Please like, share, and subscribe to the channel.
Yes. You guys, make sure you guys hit the subscribe. I'm coming for you if you don't hit my subscribe button down there. If you don't hit our subscribe button, we're going to find out who you are and we're coming for you.
All right. So hit it now. So until next time, squeeze out the like button. So yeah, bye.
Bye.